Myself, Dr. Subhaprakash Sanyal, Director of Fortis Institute of Blood Disorder, Mumbai. Today, I shall be talking about what the family should know about the bone marrow transplant. So, bone marrow transplant is definitely a curative treatment options of many hematological disorders of both adult and the pediatric population, particularly the diseases like acute leukemia, aplastic anemia, myelodysplastic syndrome, hemoglobinopathies like thalassemia and sickle cell anemia are very well curable with the intent of the bone marrow transplantation. So, bone marrow transplantation is basically a journey, not only mere treatment. The patient should get pre-transplant workup, evaluation along with the donor. Next phase is the admission and then the conditioning treatment of the chemotherapy to make the bone marrow totally wiped out, to make a space for the new stem cells to come in. Then comes in the other stem cell infusion, and then there is a lag point of time where the patient recovers their count, and then when the count recover, patient get discharged. But 2 to 3 months, patient should be in the town or vicinity of the bone marrow transplant center to understand that whether any GVHD, any other infections or any other complications developing or not. So most important thing from the family, 3 4 4 points. Number one, family should understand the why this particular person who is near or dear to her or him should undergo bone marrow transplant. So indication of the bone marrow transplant. Each bone marrow transplant has their own consequences or side effects, but most important, where the benefit should more than the risk, that communication should be very clear and loud to the family. Few things will be very clearly explained to the family, like a graft versus host disease symptoms, like after the bone marrow transplant, if the patient is developing fever which is not remitting, lot of loose motions which is not controlled in 1 or 2 days of symptomatic therapy, skin rash or itching, or significant amount of liver enzymes is going up, bilirubin is going up, or some lab parameters which is not right at that point of time, they should immediately contact with the bone marrow transplant unit. Most of the time, what we do in our center, we tell the patients to stay nearby or vicinity of the hospital. We call the patients after discharge in the daycare. We do some little bit of blood test to understand how the things are moving, and at the same time, we try to understand that whether any complication is developing or not. Most important thing in the bone marrow transplant, don't allow the complications to happen. Try to prevent as much as possible at early stages. Thank you.